Well, good morning to our audience in the United States, and a very early good morning to our viewers on the West Coast, and one of our panelists, Ji Hui, is on the West Coast. And good afternoon or good evening to those of you in Europe and in Asia, but especially to our viewers in Taiwan. Welcome. I'm Evan Feigenbaum. I'm Vice President for Studies at the Carnegie Endowment, and I'm delighted to welcome you to what I know is going to be a very robust discussion of the United States and Taiwan as we begin to come through the searing experience of COVID and begin to reflect and move a little bit, hopefully, beyond the pandemic. Now, what we want to do today is first to look back a bit at 20 years of experience, of learning, of best practices, and also of collaboration, because from SARS to avian flu to the development of new biomedical technologies, and public health modalities, including technologies for contact tracing, for example, Taiwan and the United States have had an array of important and, in my view, intriguing experiences. And then in addition to looking back, we also want to look ahead to prospective public health challenges of the future. And if we've learned anything over the past year, it's that there will, of course, be public health challenges of the future, possibly even new pandemics, but also an array of opportunities for governments, private sectors, scientists, technologists, medical professionals to collaborate for the public good or not to collaborate with the public suffering as a result. Now, I'm an American who's had a career that's been intertwined with Taiwan in various ways. And I will tell you that Taiwan is an interesting place about which and with which to have this discussion, and not just because there are a lot of prospective opportunities for trans-Pacific collaboration. Taiwan is also intriguing and important because when the history of COVID-19 is written, it will be noted, I think, that Taiwan was one of the world's highest performers in pandemic mitigation and response. And Taiwan did this partly by leveraging the very same combination that's been so successful for it in other realms: coordination across the public and private sectors, combined with the innovative deployment of technology and a high degree of social trust as well. And so we have an all-star panel today to help us dig into some of that retrospectively and prospectively. But specifically, first, as I said, what can we learn about best and not so best practices for preparedness, for response, and for the use of technology, for example, for contact tracing from Taiwan and the United States, respectively? And then second, how can Taiwan and the United States enhance their public health collaboration, including among private players? And this could involve, for example, direct collaboration, for instance, by modeling one another's practices, or it could mean enhanced development or deployment of technology for public health, or the joint modeling of practices for third parties, and of course, the joint encouragement of global collaboration, recognizing, of course, that Taiwan is excluded from most international organizations, and that this might sometimes therefore have to take place through private and creative mechanisms. So I'm delighted to be joined, as I said, by right now 3 superstars, and then hopefully a 4th when he joins us from Taipei when we resolve a few technical difficulties. Ji Hui is the director of the Center for Global Health at Oregon State University and a visiting professor at Taipei Medical University, who moves easily on both sides of the Pacific on all of these issues. Susan Landau is the Bridge Professor, both in engineering and the Fletcher School of Law and Diplomacy at Tufts University. And she's just written what I think will be, Susan, the seminal book on contact tracing apps and public health. And Steve Morrison, my neighbor down the street in Washington, D.C., is Senior Vice President and heads up all of the global health programs at the Center for Strategic and International Studies. And we'll be joined hopefully by John Chang-Chuan, who's Distinguished Professor and former Dean of the College of Public Health at National Taiwan University, who leads much of Taiwan's international academic and professional collaboration in public health. So with that as background, team, I thought maybe we could start by looking backwards a little bit. And Ji Hui, maybe I'll start with you. I'm hoping we could lean on you a little to talk first about Taiwan's experiences of the last few decades, including with SARS, but also with avian flu and then on into COVID, and how Taiwan's begun to think about public health. Or to put that another way, is there a kind of Taiwan way that's emerged, not just in terms of epidemic management, but in terms of the relationship between government, the private sector, the patient, in driving public health outcomes and practices? And you need to unmute your mic.
Thank you, Evan. I will briefly review what has prepared Taiwan for this pandemic. By now I have done over 220 media interviews, international and domestic. And I always said few countries like Taiwan had 20 years of time to prepare for this pandemic. And the first very important historical event was in 1995, February, Taiwan established the universal health care. And the universal health care did not, when they developed that, they did not have in mind that will eventually become a very vital tool for fighting pandemic. But that's a very important historical event, the universal health care. And then let's jump to 2003, SARS. 2003 SARS was the first time Taiwan's universal health care showed its muscle, so to speak, how powerful a universal healthcare system can mobilize the whole nation's healthcare resources. For example, it can determine and assign with incentive of reimbursement which hospital shall be designated the SARS treatment hospital, and also share resources, both personnel and equipment. And 2003 SARS was the historical event that prepared Taiwan for this pandemic, because Taiwan was one of the worst countries to be hit by SARS, totally unprepared, with about, by the end of the SARS epidemic, about 75 deaths, several hundred hospitalized. And towards the end of SARS, Taiwan determined never again will Taiwan face another epidemic or pandemic unprepared. So as soon as the SARS ended, Taiwan went through over a dozen of legislation that include how to mobilize resources in terms of pandemic. And at that time, part of the legislation is to legalize the activation of a very powerful, but only during emergency, for Central Command for Epidemic. The Central Command for the Central Epidemic Command Center, sorry, the CECC. And that's to be activated only during emergency. And that agency, that task force, has the power authorized by the president, can coordinate all ministry and can mobilize all resources. Along the way, went through debates, public hearings to decide how much power that CECC should have in terms of limiting personal freedom, in terms of violating personal information. And I have discussed with numerous reporters where they question the legality and the freedom challenge of how intrusive Taiwan's CECC is by monitoring individuals' cell phone. And I said, Taiwan did not implement that without severe debate and discussion. Taiwan went through 17 years of debate, legislation, revision. So these are the hidden part or the software part that's not obvious, that Taiwan went through that debate, and which is not easily accomplished during the pandemic. And so that regard, few countries has that capability. And then more on the practical side, Taiwan started to train all major hospitals, their physicians and nurses, how to contain highly infectious disease. And so every year, Taiwan continued to train that. And so throughout the expansion of hospital capability in dealing with the pandemic or potential epidemic, plus legislation that put Taiwan well prepared. And there's another important factor that helped Taiwan well prepare for this pandemic. That was because Taiwan was badly burned, and one of the cause Taiwan was caught unprepared was lack of information. And at that time, Taiwan was not alone. All the world lacked information about the emerging, because the source, China, they did not disclose the nature of this contagious disease for over half years. Since then, Taiwan decided, and this is here where U.S. could learn, decided to collect its own information directly instead of relying on any source to disclose the contagious nature. That's why in December 2019, Taiwan was among the first nation to detect something unusual happening in Wuhan area. And because Taiwan has a frequent commerce and travel back and forth, that December 31st, Taiwan was the first nation to send out a warning to WHO, International Health Regulation, about the potential highly contagious nature of this unknown disease. And I always told many reporters that unfortunately, WHO ignored that warning. Had WHO took serious about that warning, we would not be in this pandemic at all. And so Taiwan also was the first nation to activate the National Command Center on January 5th, 2 weeks before Taiwan had its first case. Taiwan already mobilized all the health authorities and designed the planning, kind of the war game against these upcoming unknown diseases. So in a way, Taiwan went through that 17 years. And then along the way, the national health insurance system was among the first, the leader in the world, to put everyone's health data in the cloud. And with a smart IC card, both patients and practitioners can access their data, their health data from anywhere. And during the Lunar New Year, the holiday, biggest holiday, the National Health Insurance Administration, they utilized this newly implemented in cloud that was completed in 2018, just in time for this pandemic. They link the total population health data with immigration data. So anytime a person entered the hospital or clinic, they knew right on time whether this person just returned from China or from somewhere else. So that was the first step. And then in February, Taiwan started to mobilize all cell phone companies to have access to their cell phone signals, and using triangulation of cell phone signals to develop, they call it electronic fence. And that turned out to be extremely powerful for monitoring and enforcing both quarantine isolation and contact tracing. And I will stop here. My colleague Changquan just joined us. Maybe Changquan can.
Yeah, I see. No, and thanks for that. Changquan, welcome from Taipei. And that's actually a good place to kick to you, because Junhui was looking back a little bit at the last 20 years. And one piece of what I heard was government coordination, the emergency center. Another was technology, the integration of databases. And then we hear a lot about social trust in the Taiwan context, partly from the experience of prior diseases and prior public health crises, where people had a level of social trust with one another, but also with the government. Something that as an American, I would have to say we haven't seen as much of here. So I asked Junhui before you joined whether there was a kind of Taiwan way that had emerged of best practices around government, around technology. And I'm wondering, because you've been so centrally involved, maybe I should ask you a parallel question. If you look back at the last 20 years and then you project forward, what are the 2 or 3 things that you pull out from the Taiwan experience that you think really have been dispositive?
Oh, certainly, yes. I would like to share some of my observations of this past 20 years. I was involved in SARS. That time we were scared. But the beginning of the diseases came from these rumors. And rumors are carried back from Taiwanese businessmen in China. and they always describe the disease, that it is the disease, and they saw people were sick. Some of them will be their employees in China, and some even die without the names of the disease. It's respiratory diseases, but just not the kind of diseases with the names that time. So in Chinese, we say 怪病, it's a disease with no name. And so it comes from the social media always. So the informal sector's information is very critical to us when we are facing a newly emerging diseases. So back in 2003, and that actually occurs by the end of 2002. There's a newspaper report in local newspaper in China, and the Taiwanese businessmen has been talking about, and they will call back, by that time to ask for help. This time again, I was personally asked by Vice Premier Chen Qimai. He was my student before, so he asked me to verify from social media there's something happened in Wuhan, and I spent I spent about 3 hours through my channels, formal, informal, to inquire. My conclusion that times I cannot confirm, and I cannot prove it and disprove it. So I get him advice that based on the SARS experience, we better to assume this is true. But what kind of disease, we don't know, but it definitely will not be SARS, because it's so easy to identify SARS now. So, but the only protocol we have is SARS. So we were first country to get on board of the airplane from Wuhan to check fevers. Right now, we know this disease is different from SARS because infection started without symptoms, but we practiced from there. And it's December 31st. We're the first one. So if countries by countries always relies on official data, formal channels reporting, then you will misread at the beginning of the pandemic. So we are so close to China, so we say that should be true. And U.S. and Europe, geologically, you thought is so far away, and you don't have this awareness, and you probably relies on your formal channel, like, and U.S. CDC probably relied on the China CDC because there's a lot of interactions between two agencies before, and you thought they will give you the data or the information. No, that will be delayed, and it will be a dangerous delay, because all the months, or in the past 40 months, we know all the measures we adopt. Speed is very important. If you want to have social distancing, if you want to have a lockdown, if you want to have border control, it's not a matter how severe measures you adopt. It's how early you adopt. And the action has to be taken, days, even weeks, before there's exponential growth of infections happen. If you look at India now, it's all too late, because we are in this pandemic, and we saw that in Italy, we saw that in New York. So the earlier we can take action, the better, and you can get good result. So this not totally rely on formal channel to get critical information. It's the first advice I would say, the Taiwan way, So when Canadian government asked me, I told them there's so many Chinese immigrants, Taiwanese immigrants to your country. Ask them, to the Chinatown, ask them. They have their channel to know something happened in mainland China. and you will know that. So the same, if you think about some of the Italians export to New York, you have to go to Italian town to ask them some of the information they have. So I think social media, take it serious. Any chat, any informations that would be very worthwhile in the beginning. The second one is, political unity is very important. And unfortunately, this pandemic occurs in most countries with a divided governments, very narrow majority, or even, there's a opposition and ruling parties. They are fighting always, and not politically, sometimes ideologically and culturally. Taiwan, we have that too. So Tsai Ing-wen was elected as a president, but 2 years later of her term, he was his party, her party was badly beaten, and the society become divided. All the issues, you have no way to have the regional, discussion. And because of the Hong Kong instance, the Chinese authorities put on Hong Kong, that allowed Taiwan to be aware of the threat, political threat, or even military threat. So the countries went through like 6 months of unifications in Taiwan. That's the whole spectrum of the society. So the biggest threat is from China. We better to face this challenge. So that's allowed Taiwan to have a majority, significant majority in the presidential elections. So that's the end of 2019. So in this pandemic, in the beginning, our country has settled down these political divisions, and that allows our government has legitimacy to implement a lot of measures. The measures we are taken sometimes infringe human rights, infringe privacy, but we have discussion, but not seriously that time. So political unity by extent, Taiwan that time is very good. But if you look at around all the problem we solved, country by country, the political division set the ground for this pandemic's tragedy. So that's very important. That in the future, if we want to think about reform for resilience, the political reform, that how can we deal with pandemic in a political divided society? That's something we have to learn. The third one is I call it the civilization of hygiene. Taiwan just came from the modern Taiwanese history is very, very short. It's about 150 years. We have the Western medicine from the Scottish. They came to Taiwan to set a modern hospital. And 150 years later, the civilization of hygiene that Taiwanese has is superior. During the Japanese time, they also taught our grandfather, our fathers, they learned a lot of hygiene practice. Keep your hands clean, keep your feet clean. All this has become our customs. And during the SARS, we were first one to wear masks. And we knew from that time, masks is necessary for any respiratory diseases, especially during the pandemic. So every household has mask storage for at least 1 box. And a significant proportion of our population in the subways, in bus, especially our female citizens. They use it a lot. So when we say that wearing mask is useful, and we mandate that to wear in public place, indoors, and public transportations, the compliance rate is so high.
Right.
And so it's really a puzzle to me to see the cultural wars in U.S. in terms of the mask wearing. But I think science plays a part in this. I had the first conversation with former CDC head Thomas Freeman back in April 2020, and we were in the Voice of America to argue about wearing mask. If you look at literatures, half and half that time, you cannot prove and you cannot disprove. So you have to take actions, and precautionary principle is very important. I argue from our Taiwanese experience, wearing mask is useful. Universal mask wearing would be good for controlling the pandemic. But at that time, the WHO and US CDC's guideline is only for medical personnel, for those people who felt that you are sick and you need to wear a mask. And we say that mask is some kinds of quasi-vaccine. If everybody wear that, and we can protect ourselves and protect others. I was asked by UK on the same things by the Royal College, and they want to give Boris Johnson advice, and I told them I cannot give you a definite proof, but wearing mask would be good. Unfortunately, they did not make a decision that time, so wait very late to do that. So, that's then we have that Dr. G talked about universal health care system. We have national health insurance system, but in terms of washing our hands, because we teach our citizens to keep your hands clean. But think about that. I spent 6 years in Boston. I travel a lot in Europe and in US. In your public spaces, you cannot find a very convenient, clean place to wash your hands as Taiwan, Japan, and Korea. Our infrastructure was there. In many public places, it's so easy to wash your hands. Our subway stations has toilets, has place for us if we want to wash hands. So if we if you instruct your citizens, say, well, keep your hands clean, always wash it. Where to wash it? In a lot of tourist sites in US and Europe, it's so difficult to find place to wash your hands. So that's, I think that's this kind of infrastructures. If Joe Biden want to rebuild, you have to build it in all the national parks, in all the train stations, in airports. You have to build as many as this washing stations that you can use it. So the civilizations of hygiene is high. So that's some of the reasons you heard before, and you haven't heard before. But it's only good for defense until now. And what Taiwan missed is we don't have very good offense tools. We don't develop. We have not developed good testing kits for COVID-19, and we did not have vaccine domestically produced and foreign purchase to protect us now. So the story is still going on. I always told people that the success of Taiwan's control is for defense now. But this pandemic is going, and we are one of the lowest vaccination population in the world. I think it scares me, and that's something we are very watchful. Yeah.
Yeah, but what's striking about that is so much of the stress that you just put in that presentation was on lower technology solutions, mask wearing, hygiene, hand washing. And that's a good place actually to bring in Susan, because Susan, the subtitle of the event is Preparing for the Next Pandemic. And especially during the first 6 months, so much of what I heard about Taiwan's success from my friends was about those lower tech solutions. But a lot of what we've heard internationally has been about the higher tech solutions, and two specifically. One, which Ji-Tun alluded to, was the use of big data to integrate large databases, right? The customs and immigration database with the national health database, for instance, to enforce quarantine on incoming travelers. But the other, of course, is the use of contact tracing apps, including wiring it with people's cell phones individually. And that's something that really hasn't taken off here in the United States at all, which raises a question about contrast between different sorts of mitigation, but also about the limits of learning and what's possible across societies. And so I'm wondering, as you look at Taiwan's experience, but also you look here, what you take away from that in terms of thinking through how technology can be deployed, what's realistic, and how we can think about learning across society.
So thank you, Evan. So it's, you're talking about, when you talk about the United States, you're talking about a society that has developed less and less trust in science over the decades, rather than more and more. And I can't agree more about the importance of the masks, for example. We can talk about the contact tracing and apps and all of that, and how marvelous the technology is. And yet, without wearing masks and doing social distancing and the elementary kinds of things we all knew how to do over a year ago, the apps are not particularly interesting or efficacious. So in the US, and I think I want to bring in Europe, even though we're really focusing on the US and Taiwan. In the US, there was tremendous interest in the contact tracing apps, because of course you could figure out who was in close proximity on a bus, in a cafe, and so on. Korea had done this without using contact tracing apps. They did use cell phone technology and credit card records and GPS, but they didn't use the apps. But the apps can pick up those people who are standing next to you on the commuter bus and the commuter train. In Europe and in the US, but in Europe by law through the European Parliament, only what's called decentralized apps could be used. Those are apps in which the two users will, if one of the users later becomes ill, the other user, if they're running the app, will discover that they've been exposed, while public health will not learn that the two people were in close proximity. And the European Parliament passed a law in April 2020 saying that only decentralized apps, which are privacy protective, can be used. In the US, because Google and Apple announced the infrastructure early in April 2020, and that was the infrastructure that was used in Europe, that one became the dominant one here for use by the states. But it was rolled out slowly, and adoption has been slow. More importantly, it's also the case that exposure notification doesn't necessarily seem to result in that many people isolating. So the whole idea of contact tracing, you test somebody and find out that they're ill, you trace their contacts, you get their contacts to isolate. Contact tracing only works if the contacts actually isolate, if you find the contacts and you isolate. And in Europe and in the US, we've seen very low numbers on that. Now, there's a UK study that shows there is a drop as a result of use of the contact tracing apps, but that study, which of course can't trace individuals because of the whole anonymity of the system is built so that nobody knows who was exposed by whom. The UK system seems to be adopted more in rural areas by people who are well off. And so that brings us back to the United States. And one of the very interesting differences between Taiwan and the US is that the US has such diverse populations. And of course, in the US, one of the things we saw was that people of color were much more badly hit by the pandemic, both in terms of rates of infection, but also very much so in terms of mortality. And those populations were working in industries. Some of them were working in industries that had high rates of exposure, like for food service industries. They were living in multi-generational families. Some of the populations, the Latinx population, for example, many of the Latinx population was unwilling to go to a health department if they were concerned about being ill, or because they didn't want to expose a relative or a friend who might be undocumented. So there were all sorts of social features in Switzerland which put out the apps. There were two very interesting features. One was that if somebody who'd been exposed called public health, and public health agreed that the person should stay home from work, if the person was not able to work, if they had a job that they couldn't do by working remotely, then the Swiss government in that case would provide funding for staying home. We don't have that kind of funding here. The other thing is that Switzerland passed a law that the exposure notification information, the contact tracing information, couldn't be used for anything except the purpose of the coronavirus. In Singapore, which has used contact tracing apps and has a centralized system in which public health knows when someone's been exposed, they know who was in proximity to them. Some of that information has been used by law enforcement and has resulted in arrests. So when you pull that all back together against the U.S. social system, it makes these exposure notification apps much less interesting, much less useful for many parts of the population. But then we have to go back to what Professor Chan was saying about the whole issue of if you can't even get people to wear masks, then why are we talking about the apps at all?
Yeah.
I can go on about the other piece of the technology that is important and interesting is, of course, not only is there universal health care, which then means there's an inducement for people to go as soon as they're ill. They know their expenses will be covered and so on, or rather than inducement, a form of trust, but also the data sharing that is possible through the universal health care. Within a day of the visit, the bill is due in Taiwan's universal health care. In a disease like SARS-CoV-2, that speed is really important in terms of tracing contacts. And so there's the healthcare infrastructure at many different ways, not just the centralized databases, but the fact that it's universal healthcare has all worked together to provide a very seamless system, but a system that in a country like the US, where, and I go back to the masks again, it's hard to imagine the same thing working here, both because of privacy issues, but also because of distrust in government and distrust also in public health.
Thanks. Steve, are there parts of the technology solution that you've seen in Taiwan that you think could be exported and scaled in other parts of the world? I mean, Susan talked a little bit about the obstacles here in the United States, but if you can situate the United States and Taiwan in the larger global context a little bit and talk about where you can see Taiwan playing a role, but also what are some of the lessons that you take from that would inform global cooperation?
Thank you. These are great, rich presentations, and I'm honored to be here with my fellow speakers, and thanks, Evan, for organizing us. We did an event maybe a year ago looking at Taiwan and U.S. collaboration, so it's been interesting for me to sort of come back to the same topic. We couldn't, in some ways, and on the surface, we couldn't be more opposite, right? I mean, we're 331.5 million people, according to the census just released, over 560,000 dead. We peaked at 250,000 a week, per day, averaged out over the week of January 8th. And you look at Taiwan, we're looking at a dozen deaths and 1,100 cases, 26 million people. And in terms of the system, we've heard a lot about a system that grew out of the shocks of 20 years ago in Taiwan that built a unified system of where data was integrated, where technology was integrated, where there was trust, where there was leadership and discipline and authority and statutory basis for this. We don't have much of that. We are operating, we've just gone through a period where we're still struggling to figure out how we can create testing, contact tracing, quarantining measures. There's an enormous amount of money in the American Rescue Plan. The 1.9 trillion has 400 million dedicated to different capacity building exercises. So there is hope. But we've had, as you pointed out, very limited experience with apps. We've had aggravation of disparities in our society. We've had aggravated social strife. We've had decline of trust. Today, as we're seeking to reach herd immunity in the vaccine coverage, we've shown remarkable progress after a tough start earlier this year. We're vaccinating. We took a little bit of a dip in the last week or two with some of the delays, but we're well over 3 million per day on average, and we're moving along, and we've moved out of scarcity into abundance. The one thing that worked in our system was the Operation Warp Speed, and we can say a bit more about that in terms of accelerating the technologies, particularly the vaccines, and scaling them and doing at-risk production and the like. But on almost all other facets of our response, it's been a disaster. And today we are facing a deeply divided country in which at least 20% of our population, probably higher according to polls that came out today, are going to refuse a vaccine. And they're concentrated among evangelicals, Republicans, rural and young voters, and particularly males. And we haven't figured out how to deal with that population. There's some experimentation, but it's really difficult. So we could, when you look at this, it's two polar opposite sort of experiences. What is happening right now is, of course, President Biden came into office on day one, had a 200-page plan of action that had been put together over the previous 6 months by an expert team, put together, issued 13 executive orders in the first day, 3 presidential memos, and the first national security directive. So came in and in an FDR-style wartime mobilization. And that holds the promise that perhaps we will break the cycle of crisis and neglect that has beset American experience throughout countless of these unforeseen pathogens that appear. We've never been able to break out of that cycle. Taiwan has, as have several other Asian countries. So right now, the prospect is on the table that we may be able to do this. This may be the pandemic that actually does change behavior and outlook. On the international side, we have been, like every other deeply impacted country, we have been deeply nationalist and inward looking. And there's been, for the first year of this pandemic, a pretty shocking gap of high-level diplomacy, a certain fragmentation and paralysis at the Security Council, at the G7, at the G20. That's beginning to change, but it's kind of it's pretty shocking to see what we have gone through in this period in which the greatest powers of the country were paralyzed. So on to your question, Evan, a couple of ideas around collaboration. First of all, there will be a 9/11 style commission in the United States that will examine what happened here. There's already a lot of preparations underway for that. Exactly under what auspices and how it's structured, et cetera, are still being worked out. And there's several options that are in development. But there will be a major 9/11 style commission that will begin in the next 6 months. And it will have to ask the question of what were the major areas of cross-national learning that Americans need to grasp as they think about this catastrophe, and the successes of things like Operation Warp Speed, begun under President Trump and carried forward now. And I think that is where we are going to turn our attention to those Asian countries, Taiwan, Singapore, South Korea, and others, to ask the question, okay, they went through a searing historical experience 20 years ago. They learned something. We had not had that sort of searing historical experience. And I think there should be systematic learning from those experiences incorporated into whatever that 9/11 style commission becomes. So that's one point. A second point is that we know that we face a global crisis surrounding vaccines in terms of access, in terms of manufacturing capacity, in terms of ensuring transparency in the marketplace, accountability. It's a chaotic, untransparent marketplace at the moment. It's one that's causing, as we're seeing this week with India, causing enormous anger and outcry and a sense of inequity and injustice in this particular process. There's lots of calls and the like. Obviously, sharing as becomes an urgent matter, but also expanding manufacturing capacity, and doing that in a more distributed basis, and figuring out the partnerships and the technology transfer and the sort of investment, and countries like Taiwan and those that have been so successful have a much to contribute in that push, which is going to take, it's going to be difficult, it's going to be painful, it's going to be complicated, but there's no avoiding this reality that right now we're moving into a world divided into two extremes. A small subset of very wealthy countries that are going to get close to herd immunity, and then a large portion who are going to be left in the dark and in the cold, waiting to figure out what to do. And some solutions like COVAX and the ACT accelerator will be important, but they will not be the sole solution. There will be a lot driven by private sector innovation and partnerships in this period. Related to that, we know that data systems have been, certainly in the United States, a central component of the disaster we have experienced is the failure of our data systems. And there's a consciousness of that. And now we face, obviously, the pressures of genomic sequencing and trying to understand how are we going to track these variants that will continue to be proliferating in populations where there's uncontrolled transmission. And so we're going to need partnerships and collaborations around data and genomic sequencing. There's going to be a lot more discussion around financing. And then R&D. On R&D, obviously, vaccines, diagnostics, therapies, we're not at the end of this process. We're at the beginning of this process. These are evolving threats that are going to require evolving technologies. The U.S. and Taiwan are already lashed up on the R&D side of things pretty significantly. I checked with NIH yesterday. There's 90 record platform funding mechanisms across 36 institutions in Taiwan today. That's very, very important. And we should be focused on how we're going to expand that. We should be focused on how that base becomes terribly important in this next phase. The last thing I'll talk about is mill-to-mill cooperation. We are advocates here in saying that this administration, with bipartisan support in Congress, should be looking at ways to expand mill-to-mill cooperation to promote health security with key partner governments, including Taiwan. And that there are, I can go into greater detail, we'll be publishing on this shortly, but the militaries have played, without compromising their readiness function and their primary missions, militaries in Taiwan, military in the United States, elsewhere, have played critically important roles and are going to remain very central to what happens in this next phase for the simple reason that they bring special assets that have proven to be so important. So there could be, I think you'll see in the NDAA, the National Defense Authorization Act language, this year in Congress, you're going to see directives there, I would predict, focused on this very issue and focused on the cooperation and expansion of cooperation between our country and Taiwan, with a focus on health security, I would hope, that looks at interoperability, that looks at matters around planning, inputs, logistics, lift, and the scientific platforms that the defense establishment brought to the table, which are highly sophisticated in this period. Just a couple of last notes. I mean, I'm curious to know how Taiwan is going to reopen. I find that, you know, in reading it, the quandary that comes with success is trying to figure out how to unravel success so that you're back part in, you know, you're going to have to accept risk of a new kind, just like New Zealand or Australia or many other places. Here, we're trying to reopen after this horrific experience and trying to get people to change their risk calculations. You're not much different in the sense that you've got to go to your population and say, you know, we can't remain bottled up like this indefinitely because it's just not feasible economically and societally and global in terms of global integration. How are we going to do that in a managed way? And it requires engagement with populations in a new fashion, just like as we're starting to open up and urge people to return to the workplace, return to college, return to churches, all of those things that have been denied to us in this period, we have to change our calculations of personal risk, and it's difficult, and it's not clear oftentimes how to manage that process, and I think, you know, Taiwan's going to face a similar thing that builds on their own success. But thank you so much.
Yeah, that's very helpful, Steve. And actually, it's a segue to some of the collaborative element. I'm looking at the clock, and I'm also seeing some audience questions starting to come in. And so maybe I can kind of fold the audience questions into this broader theme of what's missing from the collaborative partnership between the U.S. and Taiwan on public health, or the technology-related aspects of public health, or the way in which they work jointly or in complementary ways in the global setting. So some of these questions that we're getting from the audience actually have ideas, interestingly enough, embedded into them. So one, which is from Rita Chang at RFA, she says, given what's happening in India, maybe the US and Taiwan could be working together to help India in some way. So this is the idea of joint collaboration, or at least coordinated, directed at a third party that's dealing with the consequences of an epidemic. Then there's a question about, Susan, some of the contact tracing apps. And the question is essentially about demographically vulnerable groups and whether the technology for contact tracing can be improved. I think what he's saying is on the R&D side as part of a joint strategic planning effort, that even if you couldn't use all the technology and all the apps in the US, could give US and Taiwanese technologists a way of working together. Then there's a question about international organizations. Are there limits to bilateral coordination and binational coordination given Taiwan's exclusion from the World Health Organization and some of these groups? So maybe with the clock in my eye, we do kind of a lightning round. And what I would ask is, for each of you, you know, when you look at the status quo or you look prospectively, what are the 2 or 3 things that you think are missing? And that really ought to be priorities, not just for the governments, but frankly for private individuals and for professional associations too. And if you can think through some of those examples, and maybe I'll go in the order we started. We'll start with Professor Ji. You're muted. You need to unmute.
In terms of collaboration, 2003 was marked the early stage of US CDC collaboration with Taiwan, and I think in the future, in preparation for any future threat or pandemic, what both countries can do is, one important thing is sharing information. I think this was broken during this time last year. Of course, the US was being divided. And so cross information sharing has its merit. And particularly Taiwan has often have, like Professor Tang Quan mentioned, has informal channel of information from any new threat. And that part, the intelligence sharing, is extremely important, particularly also Professor Tang Quan mentioned about the speed in preparation of the pandemic. And the other are more of including the legislation in terms of how can a democracy mobilize against an ensuing pandemic threat while also protect individual freedom and privacy. and Taiwan's continue to face that challenge, and U.S. as well.
And on the collaboration, maybe that brings us to Professor John also. Is the vehicle for that, for information sharing, the CDC to CDC relationship? Or I know you lead much of Taiwan's coordination with international medical bodies, not just intergovernmental ones, but private ones. What is the right channel for the information sharing, in addition to any other things you want to put on the table?
Yeah, I think it should be upgrade, not just Taiwan CDC and U.S. CDC. I think Taiwan should be integrated in all the international communities that U.S. has played a major roles. You know, we have to bring Taiwan in. The voice is very important, not just for Taiwan, it's for the rest of the world. If people can listen to us as early as possible, then that's a lot of tragedy can be avoided. I will guarantee. But in terms of the U.S. Taiwan's cooperation in the coming 1 and 2 years to combat this COVID-19, I think that the right way to do is to bring the Operation Warp Speed to Taiwan. You know, we really need to start manufacturing vaccines in Asia. So we have to have these public-private partnerships to have the vaccines in Asia. And the original formula for Quad, thinking of the US, Japan, and Australia, and India, I thought you missed one piece, is Taiwan. And actually, the Pfizer has been in Taiwan for half centuries. You know, so it's so easy to establish a very good manufacturing site in Taiwan. Remember, Taiwan is very good in just-in-time delivery. And when Intel is thinking of the chip manufacturing, they never thought 20 years later TSMC is so efficient. So the same things, if we want to deal with Asian problems, if we cannot rely on like China or this time in Japan, they can become a powerhouse for this machine production. And we bet only on India, and India now is in trouble. So I think if we can persuade this Operation Warp Speed type to bring it to Taiwan, and we are ready. All the Taiwan's, highly educated biotech persons and engineers are ready, and we can, just what you have done in US 9 months, probably we can do 6 to 9 months, and to provide and to make the vaccine distribution more equitable. This kind of leadership that we are looking forward to from US. As we mentioned, UN, WHO this time, they are missing for almost over 1 year now because US is not there. Now US campaign has to bring the new perspectives, and we have to take actions fast. So last August, when Secretary Azar came here, I told them the vaccine is a strategic weapon. I think it still counts. So right now, it's vacancy in Asia. We don't have a good manufacturing site to produce good made in USA's machines. That's what all the people in Asia like to have. AZ has run into trouble, and they increase a lot of machine hesitancy now. So that's time for Pfizer, Moderna's, Johnson & Johnson, and even the fourth one, invented in US. You should bring the manufacturing to Asia. I think that's, if we can persuade the US government under this US defense role, then if we can pick Taiwan to be a strategic site for manufacturing, I think that's the right way. You can see that a lot of countries, including the South Asian countries, they will be very happy to have this. And I think that's if today's discussion have something conclusion, I would like to ask your help to advocate this as early as possible. And it's so easy to implement if we take action.
We had another event at Carnegie recently, and Peter Hotez from Texans Children's made this point. He said, there's so much discussion about lifting the patents on vaccines, Steve, on vaccine intellectual property. He said that's one issue, but the real issue is scaling manufacturing capacity. He was particularly talking about it in the context of Africa. And he wasn't really talking about mRNA vaccines necessarily. He said, he compared one to he said Pfizer's like a Lamborghini, Moderna's like a McLaren. He said, but for much of the world, scaling up these, adenovirus vector vaccines and some of the others is also a big challenge. And he pointed to Africa, Middle East, and Asia outside of India, where the Serum Institute is doing both the domestic vaccine and the Indian branded version of AstraZeneca. So it clearly is a challenge in Asia as well. Susan, do you want to come in on some of the technology issues and just kind of
Sure. Although what I really want to say,
what's your wish list look like for the U.S. and Taiwan?
Right. What I really want to say is something that came out of a U.S. 1993 National Academy study on the social impact of AIDS, which observed that an epidemic is both a medical and a social occurrence. And what we saw in the United States very strongly is the lack of social support in various ways, not just public health support, but lack of social support is part of the problem. And so when we think about how to handle the pandemic, whether you're talking about India, where the pandemic went to the small villages as people left the cities, closed down the cities, well, the natural answer would be people will leave if they can't go to work. And so they went to the villages, and then the pandemic spread all over. So thinking about providing the social infrastructure, not just the medical infrastructure, is one of the critical important lessons. And there, I think we probably have things to learn from Taiwan as opposed to the other way around.
Great. And Steve, I'm going to ask you to bring us home. You have a wish list for the U.S. and Taiwan, let's say over the next year, 2 years, 3 years? You're muted. You have to unmute your mic.
It's only been a year of this, huh?
Yeah,
Yes, I do, and some of the list is reflected in what we've heard already. We need to focus on manufacturing partnerships for expanding manufacturing. We need to focus on data partnerships because there's going to be major changes in countries and globalized, and much more focus on integration. I've talked about the mill-to-mill cooperation issue, which the time is right, and that will happen, I believe. On diplomacy, there's a lot happening where Taiwan may be marginalized or impeded from participating. But there needs to be a way for figuring out how to get the voice and contribution and perspective on these processes that are unfolding. The Independent Panel on Pandemic Preparedness and Response, the IPPPR, the International Health Regulations Committee. There is some technical participation, I expect, but these are also coming forward in all sorts of different fora at a higher political discussion around that. And these are going to coalesce around, hopefully, around the question of what should be the top line priorities for reform of the way we deal with this, these threats, looking ahead. And so I think there's something in the U.S. Taiwanese relationship that could help to push that debate forward and have that voice there. The last thing I'd say is we haven't talked much about the polluted digital world. We have not talked about disinformation and misinformation. We've not talked about the anti-science drive that we're living in today and how that is impacting public attitudes and public behavior. And we're learning an enormous amount about how to manage that. And I'm hopeful, actually. I mean, here in the United States, there's been some significant gains. Now, the problem is perhaps many times more profoundly felt here than in Taiwan, but it's not an absent problem anywhere. And so that's one area that we hadn't focused on that I wish I'd said a few things earlier about. But thank you so much, Evan, for pulling us all together.
Great. Well, thanks. Well, I'm very grateful to all of you for doing this. I know I've learned a lot. Steve, it's funny, in your setup remark, you pointed to some of the contrasts. You said here are two places that are very different from each other, but obviously there's also a lot that link them. Strong biomedical science, strong science and technology-based industries, a strong sense of social justice as democracies and as open societies, and a desire therefore for governments, but also for the private sector and for healthcare professionals to deliver for people in a way that, to me, suggests the opportunities for collaboration down the road, beyond, as somebody said, all the many things that they do together through their CDCs, through their companies, through investments that people make. So that gives us an agenda to look forward to, not just for the next time we do this, but for the U.S. and Taiwan and for people on both sides of the Pacific as well. So thank you all for doing this. I'm really grateful to you. And I hope the audience will join me in thanking you. I learned a lot. Thanks so much. Thanks, everybody, for joining.
Thank you very much.
Thank you.
Yeah.
Thank you.
Thank you very
Good
much
night.
for organizing this. Thank you.
Thanks.